Christian, I'm really happy that you could make it here. I don't know if you remember last time we met was at Rejuveron's virtual
I
conference.
do. It would be really bad if I didn't, because then and my aging would have progressed worse than I thought. I do obviously remember. Yeah.
Okay, well, I'm glad. I'm glad. And I think we were scheduled back then to really just discuss longevity and like more like, I guess, like moonshots projects in longevity and veered all the way to territory of psychedelics, space technology investment, cryptocurrencies, and so forth. So let's see how on track we stay this time. I should say, Foresight really has in its bylaws also a really strong interest in AI and space technologies. And so, I think if we do veer there, yeah, even the better. So let's see though. Maybe I should just bring people a little bit up to speed. So Christian, I think for those of you who may not know you, as an entrepreneur and investor and the founder of Apeiron Investment Group, which is your family office and the merchant merchant banking business. And Apeiron really focuses on fintech and crypto assets, technology, life sciences, media, entertainment. Like you have a pretty, I think, broad reach. Yes, totally. And yeah, here we are really obviously mostly here to talk about your longevity and biotech investments. And there you've really done quite a lot. So perhaps you can just get people up to speed a little bit on what is it that got you into investment in the first place, and then also particularly in the biotech and longevity investments.
Okay, great. And by the way, just like I don't know if anybody runs the room. I asked my colleague Pierre, because then I can introduce him, who's actually working at Rejuveron. I think you know Pierre, to join as well. I guess the link is the same for all of us. So when Pierre pops up, that's a colleague of mine. Yeah, what got me in, first of all, you already said it, but like, frankly, what is the connecting dot of all of our investments is it's actually literally what interests me. So very in a friendly way, egoistically, because it's my own capital. Mainly, we started actually taking outside capital 2 years ago, but sort of our entire investment portfolio, which is three big sort of, if you sort of try to sort it, it's biotech, then it's fintech and crypto, and then the third bucket we call like future tech, like space tech, AI, novel foods a lot and stuff like that. So it's all topics which I'm really personally excited about. Um, and that is, I think, is important. Really, you should do as a person always in your life, both work and private, like what you are excited about and what keeps you really like sort of focused. And I think in a certain way, even young, when you sort of do what you're excited about. Anyway, so that's sort of the connecting dot to all of them. What got me excited about longevity? I think it's very simple. I will always not understand why people are not excited about longevity, because I really am very. I always like people try to cover up aging and, oh, you get wiser. No, it sucks. Yeah. So I think there's nothing. Doesn't mean that I not want to gain like sort of knowledge. Yeah. But there is no reason why gaining knowledge should go hand in hand with sort of a declining body and mind. So for me, aging was always something very, very bad. I don't want to age. Yeah, it sucks. Yeah, there is nothing good in it. And I personally believe, I think in the meantime, you can say scientifically, yeah, it is a disease. It's a very complex one. It's not one sort of one root case. So, but we start understanding it. And some of my colleagues, like for example, Manuel Serrano, who's running one of my portfolio companies, he coined this term 9 hallmarks of aging, yeah, which now is used by everybody. So we start to understand what aging is. So this is why I'm very hopeful to over the next 10, 20 years, really find cures, at least for subforms, and then sort of being able to slow it down, halt it, and someone reverse it. And I also think, like speaking as an investor, that it's sort of one of the biggest business opportunities, because the total addressable market is 100% of the world population. Yeah, so I think that's gonna be definitely in biotech, the biggest sector over the next 10, 20 years. And it's going to be one of the most important things overall, because ultimately, you know so many like sort of rich friends who made it with this and that. But if you talk to all of them, they would spend all of their money for extra years. Yeah. So if you are able to provide that, that's going to be a very successful endeavor.
Yep. Okay. Thanks for the input. I think that already sets us up for really nicely for just exploring and tying in a little bit on more threads. So could you maybe just discuss a little bit of the focus area of just Apeiron Investment Group? Who is this for, and what are its main goals?
So what you mean? Who is this for? The main goals,
Yeah, Apeiron Investment, like one of your main investment arms. Who's this for? Like, what are its specific main goals? What is this one?
do you mean Rejuveron? Apeiron is mine, is the family office.
Yeah.
So you mean Rejuveron. So um, right?
Yes, I want to go from Apeiron to Rejuveron and
Okay,
just
so Apeiron is
but
okay. Yeah, so the structure-wise, Apeiron is my own sort of family office. So
yeah.
it used to be just internal capital. Yeah, we started raising outside capital 2 years ago, and now it's around about half. We have 4 billion sort of under management, half internal, half external, which then goes into these projects. We do actually both. So we start companies ourselves. For example, Rejuveron, the company we met, which is our longevity company, and we have one other one in the US called Cambrian. So we started both ourselves. Yeah, as we did, for example, another company which is really dear to my heart because it's my other favorite topic is mental health slash psychedelics. I started at High Life Sciences. So we have a sort of business foundation team. And then we invest in sort of third party companies from seed, so from very early on to late stage, and actually even into stock market listed companies when we find an opportunity. So we're very flexible, sort of when we invest.
Okay, very fun. Yeah, we actually had Matthias from Rejuveron at our Vision Weekend in France, and then we had James from Cambrian at a virtual salon previously. So it was
Yeah.
good to see how the dots connect. And so what?
You started one important point because, like, I think, as I said, longevity as a sector or subsector will be massive, but different than, for example, in psychedelics, where I made it to sort of because I was the first one in this millennia, at least, to have the idea to bring psychedelics back into the sort of medical world. So in the psychedelic sector, we more or less, because there are certain psychedelics and sort of a finite amount of them, yeah, we own like 80-90% of what we deem medically viable. We own the patents, IP protected. So psychedelics is way more, it's called a monopoly or oligopoly play. While I think the longevity sector, because longevity is such a complex sort of process or happening, you will need way more sort of intervention. So there will not be one single longevity company who takes it all, but there will be a whole sector of companies focused on sort of curing aging. Yeah, and this is why Rejuveron and Cambrian, as probably two companies in my portfolio, actually even exchange ideas and work together really well.
And could you maybe just focus on a little bit more on like what got you excited about Rejuveron and Cambrian in particular?
But I mean, the topic I was already excited about and was looking around, and actually both founders it's always then at the end, once you know you want to do something in a sector, it's always the founder. Yeah. So the capabilities in both James and Matthias, and obviously Pierre, who joined. I don't know if everybody sees him because there's so many. I don't never know if it's everybody sees the same window thing or if it's completely randomized for everybody. Yeah. So maybe Pierre, if you say hello, I think then you pop up. Yeah.
Hi everyone. Hi Alison. It's very nice to be there and very happy to see a familiar face from the Foresight Institute. It's great to reconnect.
Yeah. So Pierre and Matthias and the rest of the team at Rejuveron, the same with James, they were the people who excited me.
Yeah, it's very often, I think, pretty people heavy. Okay, well, we already have a few questions on the Discord, and as I should say, stop me from talking by just adding more questions on the Discord. So, in the interest of going first with Carl, do you want to ask your first question already?
Sure. Hi, Christian. I wanted to just know, you've got a wide variety of things that you are personally interested in. How do you decide how much of your personal time to devote to the very disparate areas, longevity versus mental health versus fintech?
Yeah. So it's always too little time. It's always like at the maximum capacity. The first is really like on a serious note. I really think, which I think is one way to stay happy and healthy and live long, is like I defined that I'm not working, but I'm having a hobby. So everything I'm doing, I don't have to do it. I could stop tomorrow, whatever, go on the beach, and just sort of what other people would call enjoy life, which would be utterly boring. So I really wake up in the morning, and this doesn't mean that you don't have stressful days or whatever, but like in generally, I wake up and I'm pursuing my hobby, which gives me literally more time because I literally work when I'm not sleeping or going to the gym or hanging out with friends. So it's like, because it's like, again, like people would say, oh, I want to read a book, or it doesn't bother me. That's why I can do more of it. Um, but still, then it's literally every day is filled because we have so many. It's two things. It's we have an organization, so we have 60 people, and with most of them actually I work together since a very long time. So they know me, and I always jokingly say, I think there are things I do exceptionally well, and I think there are things I really don't do well. Yeah, and my colleagues are focused on sort of looping me into stuff when I can add value. Yeah, but there is times when companies just execute, and meaning, for example, I'm not a scientist myself. We invest a lot in science. Yeah, I have colleagues who are scientists. I have scientists running my portfolio companies. So there are times they just execute, and then there's times when I hopefully can add value from an entrepreneurial perspective. So it's also a little bit like, say, driven by in which stages are companies and where can I add value at the moment or not so much. So, and I think one of my strengths is that I have a good feeling when I can add value to a company as a person. Yeah, and then obviously our organization. There are other colleagues that working with the portfolio companies on other topics. So it's sort of driven by, I would say, demand and sort of supply when I can add value. Yeah. Plus, I have a very good team supporting me, and actually, I learn a lot. So because my job is not doing a single trial, for example, it's more like and on a lot like sort of that was again, first of all, I think, by the way, you always have to build your life around your strengths. And I think my strength is that I'm very broadly interested. Yeah. But I would say if somebody comes to me and say, oh, I'm just doing one thing in life, I would say that's your strength. And it's actually very complementary to mine. So I like to team up with specialists who, who find joy in doing one thing. Yeah. So it's not a sort of competition, which strategy is better. It's A, it's very complementary. And B, talking about my strengths, I think or what I see is because we're actually doing different, even sectors, obviously we have a lot of learning within the biotech sector, but sometimes it's even stuff where you see in a completely different sector, in fintech or in whatever space they're like, hey, but that way of looking at things or approaching things is actually very smart. Why can't I do it in biotech, for example? So there's a lot of cross learnings at least I take away from our portfolio companies.
Lovely. Okay. Next one up, we have Matt Bell. And Matt, in case you care, if you want to provide a little bit of context on who you are and why you're interested in the sector, that could maybe help Christian tailor his
Oh yeah.
to that.
Sure, sounds good. So my name is Matt Bell. I have an entrepreneurship background. I had a successful exit recently, and I'm starting to look at investing. And one of the spaces I'm very interested in is longevity tech. So Christian, I don't know your background in terms of whether you have you had deep biotech knowledge coming into this or whether you learned it as you were investing, but I'm curious what your process was like of coming up to speed on the enabling technologies of longevity research such that you could do good technical diligence and be able to separate promising approaches from ones that aren't.
Yeah. So I'm not a scientist myself. I would have been if I would have finished my university. Like so the story is that so I actually had started studying finance with a side track of biotech in 1999. So it's a while ago. So I was 10 to 19, turning 20, and my two science tutors. So I had a scholarship, and my two tutors literally in the first session we met. This was my fourth week of university. They were telling me, I was actually, again, I was very interested, like I'm now, and very curious. And I was like, hey, tell me, what are you doing when you're not tutoring little Christian? Yeah. And they were starting really very enthusiastically to tell me about an idea. It was nothing more than an idea they had. And because I was about to have a science scholarship or about to, so I had in high school, like I would say, what is the English term? Like when you have the major, I think it's called.
Mhm.
But no, I had a concept what they were telling me, but let's be frank, they were 45 and were cracks in their discipline. Yeah. But
Mhm.
actually that's one of my strengths is I think I get things pretty well on a conceptual basis pretty quickly. So, and sometimes, by the way, super specialists get lost in the details. And again, you need both. You need that sort of
Mhm.
broad understanding. Anyway, so what they were telling me, I did understand where they want to go. I didn't understand the details. Yeah. But what I understood is that if they are successful, then this is going to be a multi-billion dollar business. Yeah. And that's another example. It's the answer actually to your question. If you're a generalist and as an investor, you're always a generalist. Even if I would be a scientist, science is so broad. If you're a cancer scientist, mental health, this is fairly different. You need to be able to find out whom to trust. Yeah. You need
Mhm.
trust specialists. Yeah. And so I trusted them, and I was the one who said, "Hey, let's start a company together." I talked them practically into starting a company with me, and it turned out the idea works. And the company is called Alnylam today, which is
Mhm.
that I didn't check last week with all the biotech stocks going down, but it's something like a $20 billion biotech company. I sold earlier; it's still very good.
Mhm.
Was sort of the basis of the foundation of my family office. But short version is understanding enough to know if somebody talks bullshit, but
Mhm.
trusting people enough or actually being good in picking people. So for example, like I 100% trust Matthias and James. I would always turn around to them because they're my colleagues. Yeah. We started the companies together. Yeah. And they do even really have a whole team at both companies who then do an in-depth due diligence for the project.
Very cool. And a quick
By the
follow-up
way,
question.
I wanted to, this is why I believe, like, if you look at Rejuveron, the
Mhm.
Cambria, they're following a so-called platform approach. So, Pierre, how many programs do we have in Rejuveron?
We have 5 subsidiaries, each of them focusing on one of the verticals of aging. So think telomere shortening, cellular senescence, regenerative medicine, and so on and so forth. And within each of these companies, there is one lead program and usually one or two earlier stage follow-on programs on broader indications.
And we're adding, so practically with Rejuveron and Cambria, which follows the same approach, practically I have not just one shot on aging. So they practically build up again a sort of platform where they can share resources, but have multiple shots on goal.
Mhm.
And I would always do that. So I'm not sort of, obviously, by the way, we do raise obviously regularly for these two companies because they are biotech companies. Yeah. But whatever you do, I would rather try to do a diversified shot because again, biotech is always risky. There is no way completely to eliminate risky biotech. And especially in aging, which is like sort of a new idea, like, yeah, not 100% of the projects out there will succeed, but the ones succeed, they're going to be the multi-billion dollar trucks, but you need sort of a diversified shot at the goal.
Yeah, that makes sense. I recall looking at Recursion's website recently as they were going public, and it seems like any of these biotech pharma companies, they have like a half dozen drugs under development at any given time, and it's a portfolio, and maybe one or two will succeed, but that will supply the whole value.
I know I'm a shareholder of Recursion. That's pretty cool. It's actually fairly new. Like the old approach of biotech companies was often a one drug approach. Yeah.
Mhm.
And which sort of kind of excluded. This is why biotech on stock market was always a very specialist game because you had to look
Mhm.
at that. So, and actually over the last years, these so-called platform companies like Rejuveron, Cavern, or Recursion became more popular. Yeah, where you have a theme or maybe one technology, which sort of though spits out more sort of compounds. Yeah, but sort of any sort of connecting dots, but like then multiple shots on the platform.
Makes sense.
Lovely. I just shared James' Cambrian presentation here in the chat for those who are interested in looking it up. And I think I will probably be
And
able
by the
to.
way, Alison, if you have Pierre's email, maybe put Pierre's email and mine happily as well in the chat because can I do some? I can do
Yeah,
something.
yeah.
Okay, perfect. Then
Put
you
it
have
right in
always
there.
like Rejuveron is raising as we speak. So if somebody's interested, to speaking to Pierre and Matthias about funds or investing. Always happy to, and always happy to let me know in the future if there is anything I can help with.
Lovely. Okay, great. Be careful what you're wishing for here. Next on up, we have Robert Siebert.
Robert.
Robert.
Sorry, my video is off here. So which question would you like me to ask here?
Just pick the one your favorite.
Okay, sure. So thanks for taking my question here. So I guess my first question is, what in your opinion are the biggest short and long-term risks for longevity as an industry?
Well, the biggest risk is if we don't get somebody, what everybody's working on, what we have not today, but it looks promising, is that we need aging and dying ultimately to be a disease, because that will unlock a lot of sort of potential and easiness for drug development. So at the moment, aging, I don't know if everyone knows, but aging is not a disease. Yeah. So even in the unlikely case, but hypothetically speaking, if somebody had a wonder drug and would say, look, this drug is literally stopping aging, and you go to the FDA and say, that's what I want to go for, they would say, we don't know what you're solving because aging is natural. Yeah. So, and in a very, very, very best case, they would say, okay, so you think you can stop aging? Make your trial, come back in 20 years and show us the data, because you don't have an endpoint, a natural one. And biotech, always endpoint setting is super important, because the longer the endpoints are out there, the longer you need to monitor the people, the more expensive, and the longer it takes and the more expensive it gets. So at the moment, all so-called longevity companies, they need to do a hack. Yeah. So how you do it, let's take telomere shortening. There are diseases out there. For example, there is a children disease where the telomeres of these children shorten in rapid speed. And the pictures of these children, then they look like as if they 80 when they're 20. Yeah. And that is obviously a disease. So you need to, for example, if you have a drug who can stop telomere shortening, you can say, oh, I want to cure this children disease, which is then actually very handy because it's a rare disease, so it goes very quickly. Yeah. And then you can say, and as a second use case, once I've proven that I can stop telomere shortening for this disease for children, yeah, and it's a safe drug, whatever, then I can, as a second use case, market it a bit or push it for sort of healthy people, because obviously it would be good for all of us if our telomeres don't shorten. So, but at the moment, you need to go this hack. It works, but it's sort of kind of slowing it down a bit. So the entire industry is waiting, and sort of James and Rejuveron, so Cameron, they started an industry association pushing with the FDA for two things. So accepting aging as a disease, and then defining biomarkers where you can measure that a drug works and is slowing down aging. And by the way, there are precedences where the FDA did that. Statins are a good example. So you don't have to wait when they approved statins and see, maybe the people, you wait for 20 years and then see if there are less people with a heart attack, because statins lower your cholesterol. They actually allowed the cholesterol level as an indirect biomarker for the risk of heart attack, yeah, to be the measurement on which they approved statins. So, but that is what the industry is working on at the moment. I'm very optimistic that this is working out. Yeah. But if it doesn't, that would be what slows it down a lot.
Okay, thanks for that. Maybe
I will share in the chat here the session that we had with the head of the biomarker verification program at the FDA, where we actually discussed on what their standards are that they're using for actually verifying biomarkers for different diseases, obviously. But our goal is certainly, we have, for example, one of our tracks is the policy discussion, and then there we often veer to how we can make it more palatable for the FDA to be accepting longevity as a
But the whole biomarker thing is an extremely important one, because that will not for aging, it's super important, but it's also important for other diseases, because it would dramatically eat the pain of trials, at least for some stuff.
Yeah, I posted it here in the chat. Next one up, we have Alex Seronkorov.
Hi, Alex, and hi, Christian, everybody.
many of you know me.
hey.
So, I mean, congratulations, by the way, on launching Rejuveron and Cambrian. Those are, credible biotech companies in longevity, and making a name for yourself in this area. It's also great. So both companies are preclinical, right? And I'm actually facing the same problem. So once you go clinical, you need to raise a lot of money, right? And usually that requires also a little bit different type of investor. So you are not going, you wouldn't be able to support it yourself, right? I don't know, I don't know, but most likely not. So you need guys like, OrbiMed, you need guys like, Deerfield, like Orbi Pincus, those are, my investors, for example. And when these guys come in, they look at the assets and they usually don't like to have longevity in there, right? So they like to have very clear cut, very, very straightforward pharma, even talk and presentation, right? So you are going to be very restricted in what we can do. And once they come on your board, they ensure that you are like within the pharma guidelines. So how are you planning to avoid that? Or maybe not, maybe how are you planning to get those guys involved, right? Because those juggernauts, the market follows them, right? And it looks like you won't be able to get the investors to commit unless these guys support you, right? And again, the level of funding that's required for clinical development is just different level, right? You cannot really accelerate with AI. You need to do the work, right? So how are you going to get those guys convinced and involved?
So first of all, yes. So where you're right, maybe that is because I don't see the antithesis or whatever, because they do invest. Meaning we have them, some of the names you mentioned in Atai, which is another platform company in mental health. Yeah. So what is true that some of the specialists, but just some of them, they like the one drug companies, which I said before, more because they're like, okay, we are like the super specialist that we want to pick. Yeah. But that is for some actually a lot like platform companies, because especially when they thematic, yeah, either centered around, I think what you're doing, like a sort of common engine, yeah, as a platform, yeah, or a theme like longevity or a theme like mental health. Then you have more and more, because I think people realize that biotech, and even with the dip, meaning biotech had the worst time of the last 6 months on the stock market. But my belief is still actually even more, yeah, that over the next 5 years, biotech in generally will be one of the best performing asset classes, because it's delivering what. So my overall, just to come back to the investors, my overall thesis is that if you look at COVID, something got completely not out of control, but changed, let's say neutrally, which is the price a government is willing to pay for one healthy year of a citizen. So there is this famous term quality adjusted life years. Well, yeah. Which means, and because in COVID, what I was annoyed about, that always the media was writing, we cannot measure the value of life. Yeah, which is complete bullshit, because we do it since 50 years in the Western world extremely precisely, yeah, for any disease. So the government calculates for any disease, what I'm willing to pay, yeah, for a healthy life here. And there was
Except for COVID.
Except for COVID, yeah. So COVID completely blew that up. So I think the quality in the Western world was very vaguely said around $100,000, euro, in some countries higher, lower, but it was always around that. Yeah. And by the way, right before COVID, I remember one of my best friends was the Minister of Health in Germany. And he had the discussion publicly. There is a children's disease where if you don't get the saving injection till you're 2 years old, I think you're going to die. Yeah. And that injection costs 2 million. Yeah. And they were not willing to pay that for 50 children in Germany, for children who were 2 years old. They were not willing to pay a life-saving injection, which costs 2 million, which is a quality of whatever, 100,000. Yeah. Because you save a whole life. Yeah. So, and then COVID came, and because of panic at the beginning, suddenly we threw out the concept of quality. So if you take, or we don't throw it out, like if you take now all the COVID measures, direct costs, indirect costs, and calculate the quality in the Western world, it's going to be around 1 to 2 million, very broadly said. So because we just saved the life of elderly, by the way, which means the price we paid for a healthy life here was incredibly high. Yeah. And suddenly we all agreed, or at least the media agreed, that this is the right way to do. No price is too high to save just one life. Yeah. So by the way, I'm very neutral. I think it's a little bit insane personally, but like, I'm like, this is what the people seem to want. So my takeaway is there was a big amount of panic. And panic is never a good advisor, but panic is not the only explanation. So I think half of the equation is that over the last 30 years, the desire or the pyramid of needs of the people has changed. Like 30 years ago, people maybe wanted more freedom. People wanted other stuff. There is the famous now the Hong Kong flu, where a lot of people died, was in the year of Woodstock. And I don't think the hippies would have allowed Woodstock to be canceled by party restrictions, because it was a different time. People had different priorities. So, and I think, sorry, long story, but I think it's the most important thing for biotech, because politicians always do ultimately what voters want. Thanks God. It's kind of good or bad, but like that's how a democracy works. And they are actually smarter than we think in sort of feeling that sort of zeitgeist. Yeah. And every single head of state, every single minister of health I spoke to over the last 2-3 years had this as a takeaway. Yes, there was panic. We did a lot of stupid stuff, but yes, also my voters want me to take care of their health. Still in Germany, 50% of the people want restrictions being placed because they want to be safe and healthy, and they don't want to be responsible for it. They want the government being responsible. So if I were a politician, and this is what a lot of politicians do, the takeaway is, okay, they reward me if I give them health. Yeah. So I think the quali will never go back, long story short, to 100,000. I think the truth is somewhere in the middle between the 2 million craziness in COVID and the old 100,000. And that means that the companies who are producing quali, biotech companies, should be way higher valued, because suddenly the product we're all producing sort of is valued multiple times of what it was valued before.
Yes, I would agree with it, but I had qualities like up and down in my like healthcare economics, and it was insane because the people that actually complain are not the same people, right? So people that usually like no one at the beginning knows really where things are going. So I think that it's really difficult. Like people obviously respond to interest groups, and even if you have qualities like the ones at the beginning of your life, you don't really know how much you pay for your quality at the end of your life. There's a really interesting paper from Andrew Scott, I think from the London Business School, who is actually like really making a case for qualities and how longevity, like taking care of longevity early, would be really beneficial in terms of qualities. But it's just that those are not the people that, then really care about it on the long run. Like those are not the same people that you have to appeal to later on. So I think there's always like a little bit of an asymmetry. But yeah, I certainly agree with you. I think in terms of politicians, they may have different incentives about who to respond to.
And
And if
maybe, sorry, if I can complement a bit what Christian said, and also, to Alex, to your question, I think regarding how do we actually approach those very large life science focused investors, which, as you rightly said, sometimes are a bit scared by, companies that present themselves as being part of the longevity sector. What's really interesting is it's all about semantics, right? So if you tell them, oh, we're in the longevity business, they're going to be, I had a bad experience with, a company that, that went bust 5 or 6 years ago, or something like that. And also they tend to think that sometimes, although the discoveries made in the academic circles are super exciting, but there is a lack of translatability of these discoveries into actionable drugs, right? So how do we approach this? Well, we say, first of all, when you talk to the same investors, you forget about longevity. You talk about regenerative medicine, you talk about cellular senescence, you talk about telomere science, and you show them the program that we have there. They're listening. I can tell you, because these areas are hot for them. These areas are areas that all of these life science funds will tell you if you actually ask them, we want to get into that space, right? So focusing on the actual programs and how these programs are relevant for all of these big life science funds is one way of doing it. And that's actually how we go about it at Rejuveron. And second, ultimately, the data is going to speak for itself. If you have an asset that enters into, phase 2 or that succeeded phase 2, let's say for regenerative medicine, once again, they will all be there, right? So at the end of the day, the data speaks for itself. And even if longevity, that term has a certain connotation, which these funds don't necessarily like, ultimately, all of the areas that we're working on in that space are immensely relevant for these life science funds. And so that's how we think about this.
And I guess
Yeah, my question was a little different, right? So where you answered part of that. I mean, I raised $300 million, right? And I have a lot of programs in development. Once you go clinical, so once you kind of cross that threshold from preclinical discovery to clinical, and you go after the big boys, right? So the really top funds, they will put the board members in that will ensure that you are pursuing the right thing, right? What maximizes the value for the shareholders, and the maximization of the value, is correlated with your clinical development path, right? And very often everything else becomes secondary immediately, right? So once you cross that line, you go clinical, you'll get board members who are, the former CMO of Schering-Plough, or 80-year-old people who have seen a lot of failures. And that's where your platform dies. And the focus is on, clinical development. It's not only longevity.
Yeah.
When there is longevity in the picture, it makes things even worse.
Yeah. No,
So how do you?
we're gonna have a call on that on Monday, I guess. I disagree. I think yes. So I think what you're saying is investors, especially like biotech specialists or whatever, or bigger ticket investors, have the tendency to focus on, I reframe it, to focus on short-term development. Yeah. But there are more and more. So you have two worlds. You have the biotech world, which is sort of focusing on, hey, what's my clinical program? How do I get it to market quickest? And you have the tech world of investors who rather sort of are drawn to like these moonshot projects and are especially very founder centric. But there is an intersection. So for example, we have Apeiron, which is an antibody drug discovery platform, which is exactly the same. So we have, and he's amazing, by the way. We have Felix Baker, Baker Brothers, which is one of the best biotech funds, not just as an investor, he's actually on the board himself. Yeah, and he's great. Yeah, because why? Because he trusts Carl, the founder, who's one of the best biotech founder I know. Yeah, to ultimately, because then what I tell my companies, ultimately it is about IRR. So I'm not into the charity world. So I want to make the biggest amount of money with the best IRR. But if a founder can tell me that this is happening over 10 years, yeah, but I still, again, he needs to prove me or show me or to convince me that he's doing our 10-year still the best IR, then I trust him. So I hear you, and I know because I have discussions all the time, but there is the intersection of investors who understand that platforms can be incredibly powerful. And should I tell them, by the way, the good thing is we always have enough liquidity ourselves, and we have many investors who invest with us that I can tell investors, look, you either trust the vision. Apeiron just raised 100 million, and Rejuveron is about to raise 100 million. Yeah, you either trust us in that vision, but you can trust me as the founder and investor that I'm not doing this for charity. Yeah, but you need to trust me that over 5-10 years, we're gonna develop a really stellar IR. Yeah, or you need to invest somewhere else.
Lovely. Thanks a lot. I think that we were moving on to a new question. I do think that like what you mentioned about biomarkers is something super critical to get right in this regard, because like this, we can actually measure and prove to people that we're doing good on all of these fronts, and we are actually saving qualities on the long run. But okay, moving on, we have Sonia next.
You have one last quick precision, because I actually said Rejuveron is only preclinical. Sorry, it's not exactly correct. We one of our programs is actually already in phase 1 and could have gone directly in phase 2. That's Rejuvenate Biomed. It could have gone in phase 2 because it's a combination of 2 approved already drugs, so it's safe. But we decided to do a phase 1B just to optimize the dosage. So this program is in the clinic, and the second one for retinitis pigmentosa is actually entering the clinic within the next 2 months. So it's just wanted to make the precision.
Yeah, congrats. It's a really cool story, by the way. So big fan.
Very cool. Okay, lovely. Next one up, we have Sonia Arison. Sonia is Sonia's 100 Plus Fund is the sponsor of this group. So thanks so much for joining, Sonia, and looking forward to your question.
Thanks, Allison. Yeah, this is a great discussion so far. Hi, Christian. So I'm wondering what you think is the most important lesson you've learned along the way investing, or maybe the most surprising thing that's happened to you as you've been investing in the longevity space. And maybe, how it's different from other investments you've made, but just curious about that.
In the longevity space, I knock on wood, but I've said at the moment, by the way, but like it is a very young sector. We started, Rejuveron was the first one in 2019, right? Yeah. So, or was it 18? 18.
19.
19. So, so far, knock on wood, yeah, it's going pretty well without any overly negative or without surprises in any direction. It's sort of actually moving ahead very well. So no special so far. I'm just thinking but no special. I mean, and that's all the stuff we just discussed, but that's sort of surprise. The whole FDA discussion, then it's over, and then that's a sort of a sector specific thing, but it's not a surprise. But no bad surprises actually. Yeah,
That's probably a good
sorry
thing.
for a non-sophisticated answer, but I always I'm not good at making things up.
What about the most important thing you've learned as you've been going along doing this?
It's so far it's the same about. I would say it's the general thing in biotech, but that's not new, but that proves right, literally every month in one of our portfolio companies. Amazing scientists are not amazing drug development people. That's literally 2 different worlds. Yeah. And you always are drawn to it. Even I sometimes are like, oh, somebody discovered something and they have the passion. I had yesterday in a not longevity, but different biotech company discussion with the scientist. I was like, you're amazing because you have the passion and everything, but you can't get this thing approved because you're a man. Not in a negative way. It's just I don't know, if it's just you say, if I don't know, a surgeon and whatever doctor and a skin doctor, it is so but I always have to remind myself because as a tech investor as well, you're generally drawn to support the founder who's often the scientist. And in biotech, more than in other industries, I have to remind myself that my job as a investor is in a friendly way to add people around a scientist to make sure this doesn't stay science, but someone becomes an approved product. And that is really harder than many, and that is the problem. It's way harder than many people think, especially scientists. So especially when I did it for the first time, telling them, and it's not about taking something away from them, but that is, by the way, one of the first things I always said about Matthias Steger, the CEO of Rejuveron. He's one of the very rare people who is a scientist himself, which is why other scientists accept him, but who really knows how to get shit done in clinical trials in a cost-efficient way, in a time-efficient way. That is a very rare combination.
Yeah, agreed.
Very rare. Yeah. And I could definitely just corroborate this. He was at our Vision Weekend in France, and it was, he had a very effective way and a really great way of communicating too. I have to say, very, very rare, I think.
Yep.
Okay, next one up, we have Marina Puliakova. She is a Foresight Fellow. What is your question, Marina?
Yeah, thank you. Thank you for this interview. It's really interesting. And I'm in love with Matthias as well, so I can totally confirm what Edison says. So you were one of the few investors who invested.
What is the back of your whiteboard?
It's the whole board with all the knowledge which I was supposed to learn at school, but did not.
Cool. A friend of mine emailed me because a friend of mine is doing art out of these whiteboards, and it really looks like one of his art projects, which is cool.
I don't know. It's a wallpaper. It's a real wallpaper.
Okay,
Maybe it's his work.
yeah, he's more physics. That looks more like chemistry, but like
That like all the knowledge. There is also cell biology,
cool.
lots of stuff.
Sorry, but go on.
Yeah. So a few years ago, someone told me when we wanted to start a company on depression drugs, someone told me that depression is solved. So, which
Wait,
was
like-
like, yeah, like it was from the investor space from the UK, whatever. So not everyone wants to invest in mental health. So you were one of the few, I think, who invested a lot recently. My question would be, did you also look in the neurotech? What do you think about this space?
Super excited about it. First of all, you're right. I think, but it definitely the investor was wrong. Yeah, then the depression is not just not solved. Yeah, depression and other mental health issues are. If you leave longevity out, because I would say longevity is the biggest problem because we're all aging. Yeah, but the second biggest problem is mental health. Like more than 1 billion people. And by the way, that's a pre-COVID number. Like after COVID and post-COVID, the 2020, mid-2020 number will come out like mid this year. It always is a 2-year delay for global numbers. And I'm very sure that's going to be hundreds of million more. And then in 2021, even more. So COVID made it way worse, but it's growing anyway, because my big theory is that the world we live in is really not good for our brain. So mental health diseases are on the rise. And what a lot of investors said till we came was that we do understand the brain too little. So for 30 years, mental health was neglected, mainly because of the failure of many drugs, because we didn't understand it. The reason why they failed, in my opinion, is because we left out the most important group of drugs, which is psychedelics. Yeah. So, but by bringing psychedelics back into the focus and the medical world, we have proven, we just had a phase 2b study for treatment-resistant depression with psilocybin, which is miles better, meaning multiple times better than any SSRI, and has no downside. Meaning the one is like always, are you better in the outcome? But like the other thing is people on SSRIs becoming zombies, and on mushrooms they're really happy. Yeah, did you just do it once? Like it's not even it doesn't manipulate you. It's cured. So anyway, so we have shown how big the market is now. Sort of it's became sort of very popular. Yeah, and beyond that, so I'm extremely, but it's way not solved, because I think again, ultimately both longevity and mental health, the total addressable market is really 100%, because that's, if you boil it down, that's my big mantra, is like that comes to the core what we all want. We all want to be healthy and happy. And once we're healthy and happy, we want to live at least for very long. Some of us maybe don't want to live forever, but let's give it a try, and let's sort of end it when we don't like it anymore. So, so I think we're at the very beginning, of investments in mental health, and this includes not just sort of therapeutics like psychedelics, but we invest a lot in brain-computer interface technologies. You're gonna need a lot of basic stuff like clinics, and because psychedelics will not be approved for use at home, but they have to be administered with psychotherapists together. So you need clinics, whatever. So we're investing actually the whole sort of spectrum of the brain.
Thanks a lot.
Very cool. Well, Foresight does also have, in addition to its biotech and health extension group, we have a neurotech group now as well that is working towards more of the brain-computer interface space, which actually Marina is the technology tree generator for us. So I think that fits quite well with the question, and a few other groups as well. So maybe, I mean, I would really love to know, what are your other current investment interests? Like I know that psychedelics, I'm glad we veered all the way out to this and to this discussion topic too. But what are other bits? I think that last time, we talked a little bit about the clean meat space, in our recent Rejuveron Q&A. But then there's also the aerospace that you're interested in. Then there's the blockchain, like blockchain supported, I guess, ecosystem space. And I think one thing that Foresight also has is a fellowship in DeSci, like in decentralized science, and in just better ways in which we can potentially be producing science and accelerating scientific discoveries. So I would love to know a little bit, like, what are your other bits and pieces of interest areas, and how do they relate into the stack?
Yeah. So definitely, meaning I already said it, and I think it became very clear. So mental health is my other big passion. Again, it's like because it's so going to where sort of what is the core of us being human. Then in generally the brain, like one of my other favorite companies is, for example, a company called BlackRock Neurotech. So you should go on the website. I think it's blackrock-neuro.com, I think. Pierre, maybe you can look it up and then post it in the chat. It's by far, really by far, by years ahead, the most advanced brain-computer interface. Because it's the only one. So I can say it with that proud, because like while Elon Musk, whatever, they're all still in monkeys, like BlackRock has since years an FDA approved device, which is implanted in the brain. And you find videos on the website, which if I would tell you now, I can, like, you think it's sci-fi, but it's happening now. So they have one person who is completely disabled. They have a chip implanted in the brain. And so he sits in a wheelchair, and the wheelchair has a robotic arm, and he completely can move the robotic arm with his brain, and can drink. And we think that's sort of simple, but for this person, that is sort of freedom back. Yeah. And we have an ALS patient in the end phase. So when you are completely locked into your body, you lose the ability to speak at the end, but you're still mentally fully there. Yeah, and this ALS patient can think of words. It's really what we would call colloquially telepathy, and the computer is speaking for him. Yeah, so it's batshit crazy. But and actually, that is one of the things where, if you think it's through, meaning that's now at the moment in the still early stages of the technology, and it works already, what you can do over the next 10, 20 years. So I think especially brain computer interface will bring us to the point where we really have to talk about in society, what makes us human? What do we want to change? For example, my favorite thing is like, do we need language? Because what this patient shows, and it's still very early, it's very slow, but again, for this patient, it's everything, because he lies there and can't speak, and now he can speak to his wife. Yeah. But like, give it 5 years and we could sort of send the thoughts directly. There's no big difference from sending it from brain to computer and then to brain again. So let's say in 10 years, 15 years, we might wanna discuss as a society, do we need speech? Is speech actually something which makes us human? Yeah, or is it actually a very archaic way where a lot of things get lost in translation? So I thought about it. For example, I think speech is speaking to each other in a way with the mouth is redundant. It's actually creating more problems than it solves, because like we don't speak the same language, like so many things get lost in translation. Yeah, talk about relationship discussions. Yeah. So sending emotions, pictures in 20 years might be a way better way to communicate. But like sort of that is made. So BlackRock really goes to very sort of fundamental philosophical questions. And I'm super excited that sort of we're at the forefront there. What else? When you said it, like blockchain, I can see the very, very early days. I believe in Bitcoin, which is a very simple thesis because it's a store of value. Yeah. Forget about applications, whatever. Store of value is 99% of the sort of value, but that's great because I think Bitcoin is a digital gold. Gold has I think a market cap of around about 11 trillion. I think Bitcoin is still under 1 trillion. So there is way to go for Bitcoin. Then you have the whole blockchain technology, which are represented by protocol tokens like Ether, Solana, whatever. I generally, like, my view is like, or even we are a specialist, like, or very deep in the topic, you can't pick, meaning there I feel old when I see these 20-year-old kids and they're doing great stuff, but like, sort of how do we pick? Like, so we trying to focus in crypto, the sort of big directional bets like on Bitcoin. Then we own a lot of shovel makers, a lot of service providers like exchanges. We own one of the largest Bitcoin miners in the world, like, but more the infrastructure around the scene. Then novel foods, I'm very excited because generally, I don't believe when it comes to climate change, I don't believe in don'ts. Like, I don't believe that we can change climate change or reverse it even by making people stop flying or saving stuff or whatever. Yeah. So I rather think technology will solve us, and the two big things are very pro-nuclear or actually fusion, yeah, as the next iteration. And meaning the biggest problem is literally pooping cows, yeah, or pooping farm animals, yeah, which is 17% of all emissions. And I don't think, again, you could technically say no one is allowed to eat meat anymore. But first of all, people won't follow certain markets, meaning would think you're crazy, and rightly so. So in terms of, but you can replace food like either plant-based, but I especially believe in cell-based, but sort of lab-grown. We need a better term. I hate this term lab-grown. It tells what it is, but it's not really consumer exciting. But we need to, but we're investing a lot in there. We have already a company who reached price point for dairy, so we can really make real milk and real cheese in the lab. But it is real milk. Yeah, it's just not from a cow. Yeah, meat will follow, fish will follow. So, and I think I would say in 7 years, in 7 years, eating meat will be, because if you, in the moment you can buy lab-grown meat somewhere, yeah, eating meat from a real cow will be as bad as shooting an elephant now, because you don't need it. You can have your meat then. So practically it's going to be frowned upon and being cast out of society, which is rightly so once we have an alternative. So these were like some topics.
I love it. Yeah, I think last time, we also mentioned the fusion space, but we had a previous accelerator project also in the fusion space. So it seems like there's a ton of alignment. I'm super grateful that there's someone, who has such a clear, but also, foresighted view of a variety of the interest areas that many people also in this container care about. And we have a variety of programs in all of these areas. And it's really cool to see that you're just, that you're really, you're really quite out there. It's really nice. Okay, so in the interest of time, we're 2 minutes over already. Thank you so much for having been so generous. I know we got, I think, to barely 50% of the questions, but so be it. And yeah, thank you so much for taking the time to speak with us. I think, you're doing really wonderful investments, and I'm looking forward to potentially having you back on, or maybe having a co-host meeting sometime in Germany. So thanks a lot for joining. It was really, really wonderful. Everyone else,
Thanks everybody. Let's stay in touch. You have Pierre's email, you have my email, and anytime. We can also repeat it somewhere.
Lovely. Well, I will certainly be in touch. Okay, there's certainly lots more questions that we could still get into. And for everyone else who still wants to hang out, we're in the Foresight Biotech and Health Extension channel on Discord. So I'll see you there. Thanks everyone, and I'll see you for the next discussion here on ASD with Dylan. Bye everyone.